Welcome back to Hot Flashes and Cold Topics, everybody. We are so excited today to have Dr. Pooja Lakshmin on. She just wrote a really great book. It is Real Self-Care, a transformative program for redefining wellness, crystals, cleanses, and bubble baths not included.
I love that.
And that really attracted me to your book. And I saw your book on Maria Shriver's Sunday paper. And I saw this and I thought, oh, this sounds really interesting. I've got to read this book. And then Colleen and I were talking. I said, I would love to have you on the show. So thank you for joining us.
It's such a pleasure to be here. Thank you for having me.
Well, the book is really interesting. And I think the first thing that came to my mind was the difference between faux self-care and real self-care, because it's hard enough for women in our demographic to not feel guilty to have self-care. But then you're like, well, there's a difference between what is real self-care and what is faux. Can you talk about the distinction?
Yeah, absolutely. And the first thing I want to say is that as a psychiatrist, I specialize in women's mental health. All of my patients are women. Most of them are mothers. I'm now 39, almost 40, and I have a 10-month-old. Yeah, 10? Yeah, 10-month-old. So I don't want to add, I know how it feels to feel like you're not doing enough, feel guilty because you're not getting to the self-care. So this is all coming from a place of very, very deep compassion. So it's not meant to give folks sort of another thing like, oh gosh, I'm not doing self-care, right? I start out the book by just sharing kind of patient examples, like a patient who comes in and says, Dr. Lakshmin, I'm stressed out, I'm burnt out, I'm not sleeping well, I'm not eating well, maybe I'm having hot flashes, right? And I feel like it's my fault because I should be meditating. I should go to yoga. I should do XYZ because everyone's telling me that those are the things that are going to cure my problems. And I don't have time to do any of that. And then I feel bad because I call myself lazy. And I'm sort of constantly screaming in my practice, like, this isn't your fault. This isn't burnout. This is systemic betrayal at a huge social level, especially when we're talking about midlife, whatever that word means, midlife. I think that's also, we could talk about that, what is midlife? But menopause, perimenopause, just the fact that there's such a dearth in research funding, right? When it comes to women's health, that we still don't know so much about women's bodies and reproductive system. That is a social issue. That is because of patriarchy. That is because of sexism that's baked into the medical establishment. That's because of racism too, right? All of these different things are connected. Anyway, I've gone completely off track.
No,
that's okay. I think
yeah.
The first bit before we even dive into faux versus real is I just want everybody who's listening to understand that this isn't your fault. We are all swimming upstream, and the reason we're swimming upstream is because our systems have completely let women down. So whether we're talking about the fact that, the United States is still, the only high income nation that doesn't have paid parental leave, the fact that 30 million Americans don't have health insurance, all of these different systemic issues. So when we say a bubble bath, just take a bubble bath and drink a glass of wine, I find that to be condescending at best and deeply, deeply infuriating. So the reason that I distinguish between faux self-care and real self-care is because none of my patients even have time for faux self-care. Yeah. And I define faux self-care as the products and the practices that are sold to women. So whether it is the essential oils, whether it is the massages, the bubble baths, the juice cleanses, all of those things that ask you to spend money on stuff that is supposedly going to help you get control of your life and make you feel like you're some semblance of sane. Real self-care, on the other hand, is an internal process. It's your internal decision making. It's how you make choices in your life around how you spend your time and your energy. Real self-care will always cause shifts in your relationships. Faux self-care will always keep you stuck in the status quo. So it's not that the bubble bath or the massage is bad or wrong, but it's that you have to do all of the internal real self-care work to actually get yourself to the right method that is then going to help shift the systems of power in your family life, in your work life, in your sense of self.
Mhm. Yeah, that's, something I got from your book, that it's it's got to be, these things, which are great. A massage feels wonderful. I don't know if I really want a bubble bath. I think about all the stuff sitting in there in my own dirt. But but it's got to be, it's something that moves you, that these things are not going to be a fix all. Like, what they're advertising to be is, this is going to cure you, and that one thing's not going to cure you. And I found it so interesting too in your book that I found out that real self-care was really a social movement, almost like civil rights movement. Can you talk a little bit about that?
Yeah. So one of the kind of lineages for self-care actually comes from the Black queer movement in the 1950s and the 1960s. So thinkers like Audre Lorde and Bell Hooks talked about self-care as self-preservation. And so in that context, especially for folks from marginalized groups, whether that's Black people, whether that's queer people, we're talking about self-care as a way to take back their power from oppressive systems that were basically, fighting against them. And then in the decades since then, self-care has become totally commodified. And one of the interesting tidbits that came out of my research for the book was that in the United States, after election night in 2016, Google searches for self-care actually peaked. So, as our world has become more and more chaotic, and also with kind of the rise of social media, we've seen self-care become something that is really kind of performative. It's like those Instagram pictures of like somebody sitting in front of like a mountain and they're just like in this Zen pose, and it's supposed to be sort of like peaceful. Meanwhile, you don't see like all the chaos in the background of what's actually really happening. I also think as a psychiatrist, we can think about the problem with faux self-care as also aligned with just the way in which it's so hard to find good mental health services in America. It's hard to find a therapist that actually takes insurance. It's hard to find someone who's, accepting new clients or patients. Talking about midlife, getting clear on like how much of this is hormonal, what is related to menopause and perimenopause, what is potential depression or anxiety, is this something that's clinical, like how do I know what's normal, like getting real answers for those questions is so hard. And so of course it's so much easier then if you're just scrolling Instagram to see advertisements for like, some pretty branded vitamins that claim that they're going to cure all your problems, to, click buy on something like that.
Right. And like you also say, the time involved to do that. People will probably think, this is easier. I'll click that button and see what happens, instead of really being able to find something that's really going to change them or help them for the better.
I think also, I have heard most of my life, if something sounds too good to be true, it usually is. And that instant gratification is becoming stronger as the generations come along. They really want instant information, instant gratification, instant resolutions. When it comes to mental health treatment, you talk about wellness activities versus mental health treatment. Can you discuss the distinction between the two, and why instant gratification is becoming so prevalent in these next generations?
Yes, it was really important to me in writing Real Self-Care that I acknowledged that a self-help book is not treatment for depression or a clinical anxiety disorder. I think self-help in general has not done a great job yet of separating out what can be helped by sort of lifestyle interventions versus what actually requires professional help. And it was really important to me in writing Real Self-Care to make a distinction between what a self-help book can do for a reader, which is to ask different types of questions to help you develop a new type of framework for your self-care practices. But a self-help book could never be a treatment for a clinical diagnosis like major depressive disorder or obsessive compulsive disorder. And I think it's really important that we talk more about, so I'm glad that you asked this question, because I think especially in kind of our social media world, it's really easy to sort of like conflate the two, especially since there's so many therapists on social media. I'm a psychiatrist. I'm on Instagram, right? I do this as well. And I do think that it's important for us to be there as mental health professionals, because if mental health professionals are not in these spaces, then there's a vacuum that gets filled with a lot of nonsense. And having a clinical mental health issue and seeing a psychiatrist or a psychotherapist or a counselor requires an investment of time. You're going for 50-minute sessions once a week. If you're taking medications, that's something that those need to be adjusted. I think that like I hesitate to point the finger at sort of if we're talking about like Gen Z, right, that's kind of like looking for a quick fix. I think that part of it is because they're so burnt out, and they're kind of like living in this social structure and economic environment, frankly, that is just so much more stressful than previous generations. And I think that that's one of the reasons with Real Self-Care why I have these little text boxes where it's sort of like, okay, when to seek professional help. What if I'm going through these exercises and thinking about boundaries or thinking about self-compassion and it feels too hard for me? Or what if I've been trying to set boundaries and I'm still just racked with guilt to the point where like I can't get out of bed because I feel so bad about myself? Those are what, so kind of naming some of those symptoms so that when folks are reading, they can say, oh, okay, I fit some of this criteria. That means that I need more. I need more than just this book. But again, then we do come up on the hard part of like, okay, well, then how do you find help? And that's part of what we're trying to do at Gemma, the women's mental health community that I founded, and two of my psychiatrist colleagues are also part of our leadership team. We're not therapy. We don't prescribe medication. We're kind of this third space of community and classes. It's, the master class for women's mental health is what we're calling ourselves, where you can actually get information from real experts who have the credentials, have been doing the research, are taking care of patients, and then are taking time to actually make education, for, because I think we live in an environment now where we can't pretend, like I can't just tell my patients like, hey, don't Google this. Like that's ridiculous. Of course they're going to Google it. Of course they're going to be on Instagram and TikTok. Again, coming back to what we were talking about before, the reason is because the medical system has failed women, right? And so when we don't have enough doctors who are trained in treating midlife and perimenopause and menopause, then you have to do your own research, right? And so my answer to that is like, okay, well then let's create a space where there are actual real vetted experts who are putting out evidence-based information that is reliable, as opposed to like burying our heads in the sand and saying, well, just don't Google that, because like, of course everyone's going to Google it.
Yeah. Yes. Yeah.
I don't know if I answer your question, Colleen.
No, you did, because
you did. Yeah.
Right. No, I think, it's really a complicated conversation, because you are dealing with our generation who has guilt over everything because we put everyone else first. And many of us have Gen Z or old or younger millennials, and they're being bombarded with constant information that's it, that we didn't have to deal with. It's information overload. I mean, if it's not a shooting, it's, it's one of their friends, or if it's just, there's
Yeah.
too much information being bombarded to them. So I don't know that there is the right or wrong answer,
Yeah.
because we weren't bombarded with that, but yet we're still not, either way, we're not able to get information, whether we're being
Right.
bombarded with constant stimulus, or we just have kind of generational expectations of putting everyone else first. Neither one of those individuals are getting the help they need. So if you could talk a little bit about Gemma, which you created with two other colleagues, because it does offer some obviously experienced information that might help.
Yeah. So the way that we have been structuring, our programs and our classes is, I think that it's sort of like almost like professional education, like the type of teaching that we would do as psychiatrists and faculty at our various institutions. So I'm on the clinical faculty at George Washington University, and my co-founder, Dr. Callie Cyrus, she's a psychiatrist on the faculty at Johns Hopkins. Dr. Lucy Hutner, who is the former associate director at the Columbia Women's Program, actually the lead editor of the first American Psychiatric Association textbook for women's mental health, which was only published last year, which again
Wow.
tells you a lot about the state of science when it comes to women's mental health. So, we give lectures and presentations for residents and medical students and in academic setting, but I started doing this Instagram work back in like 2018. And I found that there was just this void of like anything that was actually evidence-based. Also, everything I found on Instagram at that time was very like kid focused. Like it was really focused on like, how to deal with your toddler's tantrums, or, how to breastfeed, or how to, whatever, all those things. And I was like, well, where's the stuff for like moms, and like, what about mental health for moms? Because that was my expertise. So we started doing these Zoom classes. So it was like once a week, and like the expert would be teaching, and there would be like a small cohort of women in the class. And then there would be like an opportunity for community. So whether that was on Facebook, we moved off of Facebook, like after just the terribleness of Facebook. So now we have these WhatsApp threads. Because we also found that like nobody wants another app. Like the last thing I want is to like think about another app. So we do these programs. We have one coming up in the fall that's pregnancy, postpartum, and mental health. And so there's synchronous components where you're learning from kind of like the expert in real time on Zoom. There's also digital components where you can watch the videos on your own time. And then you can chat on the WhatsApp. Right now we have a waiting list open for the midlife and mental health program. And we're hoping
Wow.
to have that up in 2024. We've got a ton of interest actually on that class. And so it is an investment of time, but it's sort of like, let me actually hear firsthand from the people who are the real experts, are the faculty who, I'll also say folks who are in the social media space, so they know how to talk to a non-clinical audience. But it's not like, I write for the New York Times, like my patients have really hard questions, so it really is like, we link to all the primary sources, everything's cited. So it's sort of like, okay, let me take 6 weeks, and I'm going to do this program, and I'm going to have all the information. And then what we've seen with Gemma, somebody takes one of our programs and then they go to their doctor and they say, hey, I'm reading this stuff. Hey, I took this class. Here's what they said. What do you think about this? That helps you feel so much more empowered to go to whether it's your GYN visits, whether it's your psychiatrist or your therapist, and then say, this is something that I've really read up on. Can you take a look at this? Like, what do you think? That's where we've found it to be really useful, not only in the pregnancy postpartum space, because that's another space where there's just a dearth of expertise, but also in this menopause space. I have a feeling we're going to be kind of seeing a very similar thing. And then I'll also say the other lane that we're building in Gemma is also trainings for clinicians and
That's
providers.
so important.
So important. It's so
Right.
important because the other piece is that a lot of this stuff is not taught in medical school and in residency. Or if it is taught, it's taught in a silo. So you have your OBGYN that learns about the hormones, right? And then you have your psychiatrist, me, who's learning about the psychology and the identity transitions, but then there's never the time to interact, right? So what we're doing is we're bringing like professional education training for all different type of clinicians and experts. So whether that's physicians, whether that's NPs, nurses, midwives, lactation consultants, doulas, right? All the people that are kind of in those spaces to say, here are professional trainings by physicians who are bringing this holistic lens where we're talking about we're really centering the mental health piece, but we're bringing in sort of all of the medical components as well. So that's kind of our, I will be totally frank, we're bootstrapped. We're doing this ourselves. We don't make any money yet. we're just,
Yeah.
we're trying to put it together.
Yeah.
But it's, to be frank, like founding Gemma was a real self-care decision for me, because I found that when I was only doing one-on-one patient work, I was feeling hopeless about these larger systems. And there's only so many patients that I can see. And there's only so much that I can do as one person in my office. So it's sort of like, first I went to social media because it was like getting my writing out there, writing for the New York Times, like all these things are advocacy. But then it was like, okay, but I need to create something like a different type of structure that can bring this to more folks who need it, whether that's clinicians or whether that is regular folks who just want to understand more.
Right. Just bringing it together. And
Yeah.
that is going to be so helpful to so many people, because it hits just areas where people have so many questions. And then, like you said, training clinicians as well is so important. You also talk about the 4 steps of real self-care. Can you just touch on what those are? You don't have to go real deep, because you can read the book if you want to really find out about that. But yes, I thought were really great.
Yes. So there's 4 principles of real self-care. And those principles are number 1, setting boundaries. We all know how important boundaries are. In the book, I share my conceptualization of boundaries, which is that I think of boundaries as the pause. So when I first started on the faculty at George Washington University, my mentor took me out for lunch and she was like, Pooja, like, here's my one piece of advice for you. You don't need to answer your phone. You can let it go to voicemail. You can see what they want, and then you can decide. And that was like a kind of a aha moment for me, because, I had been a med student and a resident and, you always answer your pager. I was like, oh, like you can pause and then decide, right? That's the boundary. The boundary is the pause. And then you can say yes, you can say no, or you can negotiate. A boundary doesn't always mean that you're saying no, right? That's not healthy boundaries. They shouldn't be a brick wall. It's the pause. And then you get to decide. The next piece there, of course, is that when you pause and when you decide, oftentimes you feel guilty, right? Because you will be disappointing people, right? So in real self-care, I provide some tangible solutions for kind of like what do you do with this guilt, right? Because the guilt is there. So how do we deal with that? And that's a really important piece. I think you have to tackle that at the same time that you're kind of learning boundaries, because the two go together. The second principle is self-compassion. And when I think about self-compassion, it's not like mantras or crystals or like woo-woo stuff. It's really it's about how you talk to yourself. We all have that inner critic, right? That voice that's just saying, God, Pooja, like you're just so long-winded, like you're really just, gosh, could you like wrap it up here? You have that inner critic. And so the self-compassion is you being like, okay, wow, gosh, ouch. Like that's really harsh. Like why do I talk to myself like that? Where did I learn that? Right. I don't need to listen to that inner critic. So the self-compassion bit is the logical next step after boundaries, because once you start to take back some time and some space for yourself, especially if you're a woman in kind of like, older millennial boomer demographic, you have really been conditioned to then just be such a jerk to yourself about the fact that you just set a boundary. The third principle is about getting clear on your values. I think this is the hardest one, but it's the crux, because real self-care is about decision making, right? And so your whole practice with real self-care is about starting to make new types of choices for yourself that are aligned with your values, your personal values, not the values of your mom, not the values of your best friend, not the values of your partner, but your values. And this is kind of an interesting one for me, because I find that when I ask my patients, hey, like, what do you really want? What do you really like? What do you really care about? People get really angry at me. Like, they're just like, Pooja, like, I don't have time. Like, I don't have time to think about what I want. Like, how dare you ask me that question? Like, do you see my to-do list? Right? Like, so it's interesting, I think, that is often the reaction when we think about values, because especially as women, I think we just have spent so long thinking about everybody else that it feels scary and maybe like downright infuriating in some level to imagine that you could stop and pause and sort of consider yourself. So in Real Self-Care in the book, and I'll mention that there is an audiobook. I narrate the audiobook for those, because I'm finding like a lot of people, nobody has time to actually read a book. I come to the values question indirectly, because again, I think you can't come to it head on, because then it just makes people angry. So when you come to it indirectly, I have these little thought exercises. So one exercise is, and this sounds really silly, but again, you have to come indirectly. Like, imagine you only have $200 to throw yourself a dinner party. What is that dinner party going to look like? It's really easy in that example to understand that every single person on the planet is going to throw themselves a different dinner party. And there's no one right dinner party, right? And so you can imagine for yourself, like, oh, I'm going to like, we're going to have great music. I'm going to have people dress up in costumes. It's going to be a potluck because I really value like diversity, or like, and so I want to have like people bring a dish from every different continent. Or maybe one of my values is intimacy, and I want to look around and know that everybody at this dinner party is absorbed in kind of like really deep conversation. Or maybe for me, like humor and silliness is something that's really important, so I just want to make sure everybody is like laughing the whole time, right? So you kind of do that, then you pull out the values words, and values have to be an adverb or an adjective. So it can't be like, I value my family. Like, great, we all value our family. Like, that's not helpful. Like, it can't be a noun, right? So you bring out those adjectives and those adverbs. And then the work of real self-care is like, how do you thread those words, those values? How do those show up in your day-to-day life as you're talking to your teenager, as you're thinking about decisions for caring for your parents that are getting older and maybe sick, right? Like, where does the, and so I want to like also be really clear here. Like, this is hard, and there's not like everyone's answers here are going to be different. Like, I can't tell you what it is, right? And that's the crux of real self-care. Like, it's going to look different for everybody. I can't tell you what that solution is. You have to kind of work through these different principles and then see what comes out for you, and then see what those new decisions are. The last principle is power. Like, this is actually power. And I think that this is so important, as we were talking earlier about like Audre Lorde and Black queer thinkers, and how at its crux, self-care is about self-preservation. The reason that I can't give you like, here's the recipe, here's the one thing that you need to do, is because this has to come from you. And that is power, right? That is power in actually taking the steps in your own life and identifying for yourself, like, this is what needs to change. And here's like how I can move forward. When somebody tells you like, hey, make a gratitude list every night before you go to bed, like, that might work for some people. Great. But when you just absorb that and you say like, oh, I listened to this expert on a podcast and she said to make a gratitude list, usually in that case, like, maybe it'll last for a week and then you run out of time and you don't have time anymore. And then you just feel guilty that you're not doing it. Right. So it's like, you teach a man to fish. I'm going to mess it up.
You give a man a fish, He eats for a day, but you teach a man to fish and he eats for a lifetime. Something like that.
Exactly.
I messed it
Exactly.
up too.
No,
Yeah.
that's exactly. And that's the
Yeah.
whole concept of real self-care. Like you have to teach yourself. And these are 4 principles that are sort of like the guardrails. And there's thought experiments in the book and like different reflective questions, but it's really about coming to like finding your own answers.
Those 4 principles of real self-care are really ageless. But for Bridget and I, we of course apply it to the 40, 50, 60, 70 plus community. And society has told us time and time again that those 4 principles should not be asked of us, that we shouldn't set boundaries because women obviously, we do everything for everyone. There shouldn't be boundaries, and we are our worst critics. And I could go on with the other 2 principles, but it really, in a time where we should be earning the privileges and the rights to speak our own minds and set boundaries, women still have a challenge with it. And they do seek out, or they want to seek out, health and mental health around where they may be located, and they're finding a challenge with it. And we talked before we came on camera about the fact that it's really challenging to find mental health facilities and professionals for women in our demographic. How can we start the change in that? Is it just talking about it, or what steps can we take?
Yeah. I think there's a couple pieces to this. I think one, recognizing that the problem is outside of you, right? It's not that you're not smart enough. It's not that you haven't figured it out. It's not that you just need, a different productivity or organizational solution, right? It's not going to be the bullet journal. But this is a huge systemic problem in the medical system, right? I think step 2 is holding the current clinicians that you see accountable, right? So that's one of the reasons why at Gemma we are like why we have education for the general audience, but also for clinicians. Like I think the education has to happen on both sides. I think it's naive to think that doctors and healthcare providers will change on their own. I do think that it has to come from patients actually sort of saying, no, like I demand more, right? And if that means switching to somebody who is an expert, if you have the means, right? I know that comes with a lot of privilege depending on where you live in the country. I will say that one of like the silver linings of the pandemic is just how telehealth has become so much more accessible. And I'm finding that in my clinical demographic in women's mental health and also in the menopause, perimenopause space, a lot of folks like me who are experts, right, in this kind of niche area that is underfunded and underserved. That's why we've moved online. And that's why we've moved to these digital kind of avenues, because that's how we can get the information out to more people. So there might be possibilities for doing like a virtual consultation where one of these experts isn't necessarily going to be like your doctor that you're going to see in an ongoing basis, but they might be able to give you sort of like, here's how I think about this, and here's a letter that I can write to your provider or your clinician, right? So like getting creative. Again, and I know this is so hard and it shouldn't have to be on us as women or patients. I'm a patient too. I have my own psychiatrist. I've been in psychoanalysis. I take Zoloft, so
Yeah.
I know how hard I went through IVF to have my son, and that's a different story. But right, it's terrible when it comes to women's health that we are the ones that have to do all the research, hold everybody accountable, keep everything, like I know that that's not fair. And the reality is I do think that that's the only thing that's going to bring about change. And so, but the good news is that I see it happening on different sides, right? Like I see it happening in the medical community, right? Like not just with Gemma, but other folks in this space. And then I see it happening in journalism as well. There's a lot more awareness now talking about menopause. I just saw Oprah's recent kind of bit. So I think it takes all of us together. And then the other thing that I would say is that like sharing your resources with friends, we all have like our group, whether it's like your text threads or your Facebook groups or, or in real life, your book clubs, right? Say, I found this great doctor. She really listened to me. This is what, like if anybody needs a referral, like here she is. And asking friends, like word of mouth is so, so important when it comes to finding the right care.
It absolutely is. And just with the fact of it being telehealth,
Yeah.
that's come out, it reaches so many people that don't have access in different locations.
Yes.
That has been such a problem. And with hospitals closing in rural areas and care there, I think telehealth is so important in that
And I will
aspect.
say, like, I get DMs from folks that are just like, hey, I live in like such and such place. Like, do you have any recommendations? And I try as much as I can. Like, if I know a name in a certain state, like I will just DM it. I can't get to all of them, but like, you never know. So it's funny. People are like, gosh, like, why are people getting health advice on Instagram? And obviously I'm not providing medical advice, but I'm like, the reason that women are there is because like they can't get it in their own real life. Like, that's why they're doing it,
Mhm.
And that's
Absolutely.
what we say often, we aren't the experts for all of your midlife and menopause questions, but we'll find the people who are to get
Yep.
the answers that you can trust and that
Yes.
their expertise will be shared. So thank you so much for coming on the show. We will have all the links for Gemma and the book, Real Self-Care, a transformative program for redefining wellness, crystals, cleanses, and bubble baths not included, which I love. So thank you so much for coming on the show today. We appreciate it.
It was absolutely such a pleasure. Thank you so much for having me.